Hypertension and brain health, playing with fire. Yes, if you are allowing hypertension to occur and you're not doing anything about it, or if you think it's okay managed, but not as well as it should be, you are completely playing with fire if you like your brain, right? And sometimes, when you play with fire, it turns out okay. And other times, it doesn't go as well as you like, and you do get burned. The same thing is true with the brain. What I'm going to do today is I'm going to review with you some of the research as to what we know happens with hypertension and brain health. Um, Check out some of my other videos if you've not seen them yet. But what you'll probably notice is I'm going to talk more and more about hypertension and really just vascular as well. We take for granted how much we really need to focus on a holistic approach. Yes, I'm the holistic guy, so I've been doing this for a long time. But even that alone, it tends to not be enough. So let's really dive in, because I know I've been guilty of it in the past, and many other medical providers would also agree that, hey, 130 over 85, 140 over 90. I mean, it's off a little bit, but it's not that big of a deal. So before I go into the research on what happens with 140 versus 120, let's just talk about this, right? So this is a research paper. So Nature Reviews in Nephrology, hypertension-induced cognitive impairment. Okay. So what happens with this? When we talk about hypertension, everyone knows about, right? It can occur in diabetes or contribute to diabetes, vascular issues, heart attacks, strokes, kidney failure, and many other things. But we often ignore what it does within the brain. Now, your brain receives 20%, it's 20% of the entire body's vasculature. So it's a ton, but it's only 2 pounds. It's really small. So when we look at this now, one of the things you'll see in MRIs is you'll see it being reported as small vessel disease. So anyone that comes in and they're worried about a neurodegenerative condition because their parents had dementia, or they themselves are showing signs of memory issues, more frequently walking into places, forgetting what they were going to grab, just not as sharp as they used to be. They're not able to tell you what they did a couple days ago, even though 2 years before that, they definitely could. One of the images I do, it's called a neuroquant. This is going to look at how big each and every part of the brain is. But in that, because it is also partly a standard MRI, is the radiologist is going to note, is there small vessel disease? Now, the problem is a lot of these will say, okay, well, there's some small vessel disease, it's minor, or, oh, it's acceptable for age. The problem is, should we really consider that as an acceptable thing? So this diagram that I really like, hypertension due to small vessel disease and how it manifests on imaging. So hypertension, as well as aging, can lead to damage to the smaller blood vessels. So that's the microvascular. As a result, you see there's a laundry list of things. Now, the one I want to focus on more so than anything else is the endothelial damage. So this is kind of the lining of the blood vessels. And when it's damaged, it can ultimately lead to ischemia. Ischemia is reduced blood flow and oxygen to an area, ultimately reduces blood flow. The other thing that happens with endothelial damage is you get a blood-brain barrier disruption. So you've got if you think about your brain is this privileged site. Yes, it sits up top, but it has a barrier to control what goes in and out, which is critically important now with pretty much any dementia or neurodegenerative condition, even including Parkinson's disease. Now, even blood-brain barrier disruptions do occur following strokes, concussions, traumatic brain injuries, and other things. But we want that blood-brain barrier to heal and repair. If you're stuck in this chronic inflammatory response with neuroinflammation, we can't expect that blood-brain barrier to truly heal. So there's a lot of things that have to be done, and you need to really know where you stand. Now, here, one of the things you'll also see is in the neuroquant imaging, they will talk about white matter hyperintensities. And as they say, hey, these are very common finding on the brain MRIs of patients with hypertension. Once again, hypertension. These should not be readily abundant. Now, unfortunately, in a lot of these, because they're used to seeing these are a common finding, but common does not make it normal. These are associated with substantial cognitive impairment and a threefold increased risk of stroke and a twofold increased risk of dementia. This is not good. Okay. This is not good. Now, this ultimately damages the white matter, which is the tracts, leading to inflammation, gliosis, it's kind of scarring, and then ischemic damage, all of which is made worse by hypertension. And as we said, the blood-brain barrier gets disrupted, is also something that happens. So this is not a good thing if you care about your brain, and especially with the rates of Alzheimer's and the other types of dementia going up. And also we have Parkinson's disease, which is the fastest growing brain disease at this point in time. Hypertension is not something that we should be taking just as a passive thing that's just happening. I get a lot of people are like, oh, well, I mean, my blood pressure is down to 150 because of what we're doing. It used to be 170. This is fantastic. And that is better, but you still need to do this as like, this is a 5-alarm fire. So this is something where we're still waiting for it to be published, but they did release it. So the American Heart Association, what they did was they looked at differences in MRIs and structures and how ultimately the brain was able to remove toxins and other byproducts with a difference of 120 to 140 as the systolic number. So that would be the high number. So now they follow these people over nearly a 4-year period. So once again, the treatment group was 120, and then the other was 140. Now the treatment group received whatever for treatment. Okay. There was not just one treatment. It was more about managing them and getting it to where it should be. So we know, this is no longer a dispute. You need to have your blood pressure properly managed to get it to where you want your brain to be. Okay. Once again, I cannot stress that enough. If you don't control your blood pressure, I hope you don't expect to have good long-term brain health, because you really are playing with fire and there is so much that you can do. So what are some of the basic things that should be done? How you eat, sleep, stress, exercise, and socialize. Those are the 5 basics. So once again, how you eat, sleep, stress, exercise, and socialize. Get your heart rate up. Maybe do some weights. Eat fresh, healthy foods. A Mediterranean diet, has shown great benefits. Also, make sure you're getting your sleep. Do not sacrifice it. Control your stress. Life's too short to have a lot of negative people around you that are really making everything worse. I understand some of it's going to be from your family, but you cannot take care of others if you don't take care of yourself. And the other thing is, nothing tears apart families like dementia. And I do strongly believe that most dementias are completely preventable, but you can't wait till you have a lot of symptoms showing up. And hypertension is one of those early things. Get it taken care of, get it under control. I hope you found this useful. Check out my other videos if you haven't yet. And if there's anything specific you'd like me to do a video on, let me know. Once again, for me, I love the brain, but included in the brain is going to be depression, PTSD, anxiety, concussions, TBIs, dizziness, vertigo, but even the immune system. Because remember, as I said at the beginning, we cannot separate the body into isolated pieces. That is what's got us into this mess, but it's not going to get us out of it. So we have to treat the body as a whole unit, and only by doing so are you going to get the best results that you'd like to receive. This is Dr. Z. Until next time.